Hello everybody, this is Jeff Vanderbeck, publisher of the Appalachian News Express here in Pike County, Pikeville, Kentucky. I'm here today with several guests. We're talking about the coronavirus, what's happening, and an update on the status of what we should be looking forward to. To my left is Tammy Riley from the Pike County Health Department, Dr. Fadi from Pikeville Medical Center, and Pike County Judge Executive Ray Jones. Thank you all for coming. I appreciate your time. I'll get started by asking questions, and we're just going to go ahead and start answering some questions on this very important topic and see if we can kind of quell some of the fears that are out there and some of the stereotypes and some of the things that people are asking questions about, because it's very vitally important that we get the information out to the folks. First thing is, Dr. Fadi, what is the coronavirus and how and where did it originate?
Okay, thank you for having us today anyway. The coronavirus is a major problem now, and we think that the coronavirus is sweeping the country. We have waves of infection affecting the whole United States. We have over 1,200 patients so far, documented cases so far. We're talking about 38, 39 cases of fatality. In the state of Kentucky, we have around 8 cases. We don't have any case of fatality. But the key here to be here together is to reach out to public, because knowledge is power. We need to empower people with information, with details, with some sort of guidance, and that's why here we're talking about the COVID-19 and what steps we need to get the people involved to ban that problem from happening in this area.
So where did it originate? It originated in China, is what I'm understanding?
So this is a good question. When it comes to the origin of the virus, we think that the virus comes mainly from China, from Wuhan, from the wet market. So this is when we started to see clusters of cases of upper respiratory tract infection as well as lower respiratory tract infection. We believe this is mainly an animal derivative infection. However, down the road, we started seeing a lot of human cases, human to human. And this is becoming the main mode of transmission of the virus. And then down the road, that virus, that enemy is starting to cross the borders and affect almost the whole globe. So we have every single continent in the world now almost involved with this kind of virus. To be honest with you, we don't know exactly the source, which animal is getting involved in that process. We're still in the study to figure out exactly which one. We believe the bats are the main reservoir. There should be some sort of intermediary. At this point, we don't know exactly which one, but everything is subject to further analysis and study.
How is the disease transmitted and how contagious is it?
The problem with that new COVID-19, it is very contagious and it has long half-life. We're talking about 2 to 14 days, and that's why it's moving very fast, and that's why we have that infection sweeping the whole entire country as well as the nation. It is mainly a virus-laden droplets as well as fomite. What does it mean? If somebody has the disease, you can expel all these infection and ease these droplets around. We're talking about 6 feet like distance of mode of transmission. So if you have these particles or these droplets on the ground, you can also get them by contact. So if you contact dirty spaces or infected spaces and put them on your face, on your eyes, on your nose, you can get the infection directly in your body. We believe these are the main source of transmission. So we still also work on, could be an airborne infection. Some people, they're talking about fecal oral route, which is very small percentage of the infection, but this is definitely could be one of the source of transmission. That's why we recommend even washing your hands after using restroom and the bathrooms.
Sure. How does this virus differ from the common cold or the common flu?
Okay. This is a important analysis, because anytime you compare the COVID-19 to the flu, you create some sort of false security. And the reason I'm saying this because the flu is a done deal situation in the United States. It's affecting a lot of population. We're talking about around 32 million people in the United States being affected by the flu. We're talking about 18,000 deaths almost every year. The good thing about the flu, you have vaccine. And we have that vaccine modified almost every year, every second year, because of the changing attitude of the virus. The problem with coronavirus, this is a new virus. We don't know exactly what kind of be the attitude of that virus. We know this has long half-life. We know this is very contagious. We are talking about mortality of 1% to 3.4%. We're talking about 10 to 30-fold higher mortality than the flu. So drawing comparison between the two of them, giving people some false security, and this is not should be a problem at this point, because we have to distinguish between these two entities. The problem is the two things coming and affecting our community together, and that's putting too much burden on us.
So, is it too late to get a flu shot? And if I received a flu shot in October, am I eligible for another flu shot for this year?
we recommend everybody to get the flu shot. This is our strategy because the flu shot is very preventative. So every year, everybody should get the flu above the age of 6 months and older. They should get the flu vaccine from October all the way through the flu season. So never been too late. If you still have some sort of activity, definitely we recommend everybody to get the flu vaccine because this is going to be the front's defense mechanism to protect you from catching the flu. And I think this is very important here because instead of having two problems going on at the same time, let's get one away from the equation, try to deal only with one problem.
Well, we're still seeing a lot of flu, influenza across the state and the country.
At the health department, does the health department administer flu shots, and do you have plenty of vaccines available?
We do. We do flu vaccinations, and we have ample supply, and
Okay.
we do still highly recommend, if you haven't received your flu vaccination, there's a lot of benefits, as the good doctor here could share with the public. There's a lot of benefits to still receive your flu vaccination if you haven't this year. And there's about a 2-week for full effect of the flu. It takes about 14 days, is that correct?
That's right.
But from day one, you start seeing some effects and some benefits from having received the vaccination. So today's the day to get it, and dealing with influenza, and we're still seeing a lot of that reported, would just further complicate issues.
Absolutely. And,
So-
and even if you have the infection, if you get the influenza shot, this will protect you from having severe problems. So this is attenuating all the major symptoms coming from the flu. So absolutely beneficial for everybody to take the flu shot.
So it's real important to get a flu shot. Tammy, if the health department's got flu vaccinations available, why don't you explain to people who may be watching the program on what they should do and what the steps to take to come to the health department to get a flu vaccination and a flu shot?
Well, we do same-day scheduling. They can call that morning if they want to come in, and the number is 437-5500. On Fridays afternoons, we do Fast Pass. You can just walk in, guaranteed no waiting. But we do same-day scheduling any day, and we always expedite flu vaccination requests. And we do have ample supply. So you just call that number the day you want to come in. If it's Friday, just walk in, and we expedite all flu requests.
Sure. Okay, great. Thanks. Judge, this virus is all over the media. I mean, every time you turn on the TV, you pick up the newspaper, it even hit at the News Express. It's out there. The media is making a big thing of it. Is the media making a bigger thing out of this thing? What's all the hype about? Is the hype worth it? I mean, and how is this affecting the county from doing their business going forward?
We've seen some people, there's sort of two schools of thought on this. We've had some people that I've talked to who say, oh, it's being blown out of proportion. But at the end of the day, we have to listen to physicians such as Dr. Alacross, and we have to listen to our epidemiologists through the Department of Public Health. It's really a serious problem. And I think the point that we want to make is, even if we have a diagnosed case or cases that start to pop up in Eastern Kentucky, the first thing is for people not to panic. The real thing that we've seen in Italy, and my wife brought this up today, being a family physician, is that the cases have gotten so voluminous that they're overwhelming the healthcare system. And the thing we want to make sure, and Dr. Fadi can go into this in a minute, about what, if you think you have potentially been exposed, what you need to do. But the first thing is don't panic. He'll walk you through that step. Contact the health department, contact your family doctor. We want to make sure that the public understands that even if you get this, it isn't like it's a death sentence. Most people really have mild symptoms. There are certain age segments of the population that are much more at risk. And we, at the county level, we had a meeting, I believe it was on Monday, Tammy?
Yes, it was.
We had representatives from our school districts, our hospitals. We have reached out to the business community to make sure particularly the large employers are aware of what we're doing. And we need to take steps to make sure the public is educated on this. Yesterday, Tammy and I did a program on the Pike County Report, and the main focus was to make sure just washing your hands, soap and water, is the first step to prevent the transmission. It's obviously a serious problem, or the NCAA, major sporting events that generate hundreds of millions of dollars are canceling because that health professionals around the country, CDC, National Institutes for Health, they recognize that the risk is greater. And as the doctor said, when your mortality rate is somewhere between 10 and 34 times higher than the typical influenza, that is a significant problem. And I don't think that the media has really overstated that.
Yeah, thanks. Doc, who are the most vulnerable people for this virus, and what are the symptoms versus the common cold or the flu? What should people be looking out for?
And I concur with Judge about how serious is the problem. This is not a drill. People, they have to understand that. This is not a drill. This is a serious condition. And we need for people to be educated and to be oriented about that subject, because we need them to help us. In my opinion, people are the soldier in that war against that invisible enemy. So they need to be educated. They need to do the right thing to be able to fight the process, because we can give them guidance, but they need to follow the guidance. They need to take this very seriously, and they have to do their civic duty, and they have to protect themselves, protect their family, and protect everybody else in the community. The problem here in our area specifically, we have a lot of vulnerable patients. We're talking about people with high rate of smoking. We're talking about lung disease. We're talking about heart disease. We're talking about cancer, immunity issues. So all these definitely are serious conditions that can lead to complexity and severe conditions. And if you look at all the analysis from China, age by itself is a risk factor. If you go on the list above the age of 50, you're going to increase drastically your chance of mortality, like from 0.4% to 1.3%. And this is crazy when you go above the age of 80. You're talking about 14.8%. So we're talking about deadly disease, especially in certain specific population. And that's why we need to take all these precautions to prevent that disease from coming to us, to attack our people. And when we take all these measures, we try to protect these vulnerable patients.
So the elderly folks are the most at risk, particularly folks who have pre-existing conditions like heart disease, liver disease. Smokers are at higher risk. So what symptoms should people look out for? If I'm a caregiver of an elderly parent, what symptoms should I be on the lookout for?
So in general, the majority of patients getting the infection will have upper respiratory infection. And this is very important to know that the virus will go mainly to upper respiratory system. They're going to be in the nose or in the mouth. And the majority of patients, 80%, will have something like more than cough, a little bit like a runny nose, sometimes fever. The problem with that infection, symptoms will not appear before 5 days. And that's very challenging, because posing risk of spreading to the community before developing symptoms. And that's the difference with SARS. SARS is more fatal, but the symptoms will appear immediately. This disease has longer half-life, but very contagious, and symptoms will take a little bit longer to appear. Fortunately, 20% of people, especially the frail people and the vulnerable people, they have what's called lower respiratory tract infection. The virus will sneak down to your lung, to your tissue, to air pipes, causing sloughing of your inlying. And this is very important, because these inlying, they have what's called like hair, and these hair are very important to sweep all the dirt from the lung. And subsequently, the lung is going to be exposed, and the virus can go directly to the lung tissue, leading what's called to pneumonia. That pneumonia has two aspects. Either the infection will hit the lung directly by itself, or your immune system trying to protect you by trying to clean all the infection from there. And by doing this, you create a robust immune system, robust reaction. And then on the top of that, you'll be subject to what's called bacterial infection. And by doing this, what's going to happen? All these stem cells in the respiratory system are going to get completely messed up. There is no rejuvenation of the respiratory symptoms. So what's going to happen? There's going to be deprivation of oxygen, and all your vital organs are going to be affected. Your kidneys, your heart, you're talking about your brain, every single organ is going to be affected. That's why some patients go into septic shock, some patients will go into respiratory illness, 2% they will require ventilation, and 1 to 3% might die from that infection. And definitely, patients who have the comorbidities are the highest chance to die from these illnesses.
So if I'm a caretaker, if I see somebody around and at home or at school or at work or anything like that who have persistent cough, dry cough, looking like they have a fever, sneezing, runny nose, those are the symptoms. What should this person do? What should I do as a caregiver to this person, or as an employer? What should I tell this person to do? What action needs to be taken immediately?
Okay, first we have to send a message to the public. We need to follow the prevention recommendation that applies to all kind of infection. We call them the 4 C's. We have meeting before, and we come what's called the four C's: calm, clean, cover, and contain. And these comes like hand in hand with the CDC guideline. You need to wash your hands carefully. So wash your hand carefully with soap and water for 20 seconds, as often as you can. And if you can have no access to the sink, try to use the alcohol 60% and try to rub your hand very carefully. If you cough or sneeze, please cover your mouth and your nose and try to dispose the tissues in a wasting area, because also these wasting like materials could be a source of infection as well. So you have to be responsible when it comes to disposing all these materials. On the top of that, if you're sick, I know it's not nice to not work, but if you're sick, you have to be responsible. You have to stay home and avoid people from getting like in close contact with you, because the way how you spread the infection by being in close proximity to patients and to people, we're talking about 6 feet distance. So you need to avoid that, and as well, you need to avoid being in contact with sick patients as well. So all these strategies are preventative from catching any kind of infection, especially the COVID-19. So we need to be serious about that. Going back to the point, if you have symptoms, if these symptoms are not so bad, I recommend public to not hit all the emergency departments and the clinics at one time. This is not the goal. If you have mild symptoms, grab the phone and talk to the clinic, talk to your physician, and take advice. You can talk to the health department as well. I want these people to get advice from their physician to see if they need to come to the office or to the hospital or not. Coming to the hospital and having the infection, this is going to spread the problem and is going to create more like burden on our healthcare system. So this is basically my advice. If you're sick, if you have issue and your symptoms are mild, try to talk to your physician and find what's going to be the best solution for you.
And the Department of Public Health stepped up, and statewide we have a hotline that's available 24/7. There's nurses on the other side of the hotline. It's 1-800-722-5725. And of course, you can always call the health department, 606-437-5500. And we do have after hours 24/7 service for that line, but we do encourage, for the worried well and those with symptoms that would, if you normally wouldn't go to the emergency room, don't go to the emergency room now. Call the hotline or call your provider, those people that you would normally call and seek advice.
We definitely appreciate the health department for that, because definitely they're doing a great job during this period.
Yeah, I'm sure right now all the doctors, the health departments, or the physicians, family doctors and hospitals and clinics are kind of bombarded with all kind of stuff. So the health department can kind of weed out a lot of those calls. And,
Yes.
and if somebody does have mild symptoms, they should be encouraged to either call the 800 number hotline,
Yes.
or call the local health department, or call the health department at
Absolutely.
437-5500. The health department can walk them through what should happen. And if their symptoms are severe enough, then the health department would then direct them to where?
Yeah, well, we have a regional epidemiologist on staff. We have a clinician line with the Department of Public Health, and then we would reach out to primary care providers locally for assistance as well. But we have ample resources to assist.
The simple thing as well, if you want to talk to your physician directly, if you have, let's say, if you have a physician, established physician at PMC, grab the phone and talk to that service. And then definitely they will guide you. They'll be more than happy to take care of that subject and will tell you exactly what advices you need.
Sure.
Okay, either you come to the hospital or you stay home, and our folks definitely, they're going to do a great job regarding the subject.
Judge, the county employs a lot of people, and basically you're the CEO of the county. If you have employees who are maybe experiencing, are you seeing lots of people taking off from being of work from being sick? And what recommendation are you asking your people to give to your employees?
Well,
and should employers give to their employees as well?
I think at this point in time, seasonal allergies, starting to become a problem. The flu's still there, and a lot of these symptoms can mimic, COVID-19. I think that's a fair statement.
Fair statement.
We're encouraging people, if they're sick, to stay home and at least call their doctor, find out if the symptoms merit staying home. And, we're also working to make sure, I had a conversation with their jailer, Brian Morris, today. We're working to make sure that the jail population, there's over 400 inmates in the Pike County Detention Center. We're basically shutting visitation off. Brian has implemented a policy, no face-to-face visitation, because we have to protect that population as well. We're also working to make sure that the health department has the resources they need, whatever we can do. I have had a conversation with Rocky Atkins in the governor's office, encouraging them to set up a regional testing center to try to speed up the turnaround times for the swab tests that are being done to have a definitive diagnosis. But I want to go back and remind people, we are fortunate that we have not had a diagnosed case in Kentucky or Eastern Kentucky, only 8 statewide so far. And we're very, very fortunate. And I think the main thing that we want to do is continue to try to educate people so that we don't have any cases. That's the whole goal. We don't want this disease here. And today it's my understanding that most of our local school districts are going to be, the doctor has been in conversations with the local school superintendents, Pike and Pike County. I think they're going to be shutting down for a period of time. And hopefully in a few weeks that this epidemic will die down and we can get back to normal life.
What is normal, right?
What is normal.
Exactly.
But
So-
again, I want to basically say to the public here, I don't want also the message to go to them that if you're sick, stay home, do not come to the emergency or the clinics.
Right.
The message here, we need to make sure that you're safe as well. So if you feel that your symptoms beyond the level of control, we don't want that to happen. You need to seek medical attention as well. So that's why that conversation between that patient and that clinic or that physician or the health department is critical and pivotal to navigate the process. We need to know, yes, you need to come to the ED. Somebody has a respiratory illness and has difficulty breathing, cannot breathe, coughing blood, doing something like that. They cannot stay home. These patients, they need to seek medical attention as soon as possible. But somebody has minimal symptoms, like a bit of cough, they have no fever, they have no major symptoms. These patients definitely can handle stay home and they can get treatment at home. So I want people to be guided regarding these decisions as well.
They say that flattening the curve is going to be a key in preventing and treatment of this disease. And by flattening the curve, it means transparency with what's going on with the local health departments, local hospitals, local governments, and so on. But it also calls, the CDC calls for people to become personally responsible. And I think with what we've got now, if people are experiencing some sort of symptom, whether it is a seasonal allergy, like Judge Jones said, or they have a flu or a cold or something like that, I think the first line of defense should be to, like you said, pick up the phone, call your provider, and or call the health department. So at that point, the way to flatten the curve would be to administer to the people who are confirmed, and this way we're hitting the people who are actually sick and need the health right away. Can you kind of expand on that about flattening the curve and taking precautions, and also Tammy, with you as well?
So we can,
Well,
Tammy will start the conversation.
yeah, absolutely. And I've had many conversations with the CDC. We're very fortunate to have a local CDC representative here in Pike County, and also the regional epidemiologist. And they've taught me a lot about the curve. And what we do know is things like that you mentioned, but also when someone's ill and you have mass gatherings and people aren't practicing good social distancing, all those types of environmental influences, events where mass gatherings occur that where individuals are ill and they're out intermingling, those types of activities or events create a spike in that curve, and that's what we know. And when you create a spike, the doctor can tell you what happens at the hospitals and with the healthcare providers.
And again, I want to go to the point about that illness. So symptoms will appear after 5 days, most of the time. So for 5 days, people, they have no symptoms, and they could be contagious and spreading the infection. The problem is we don't have enough testing to test everybody, and this is the problem. Once we have access to more tests, we'll be able to pick more patients, and we'll know exactly what's going to happen in the future. So access to more testing is going to be the key down the road to be able to prevent the problem. Because at this point, I can test only the patient who qualify for testing. So somebody who's really sick, they have symptoms, and usually we test the sickest patient, and we're talking about the 20% of the patient. And that's why if you do the math, if we say just 20% of the patient are being tested in Kentucky, and we have 8 confirmed cases, which means we have 5 to 8 or 10 more cases in the community. We're talking about 40 to 80 cases in the community because never been tested. So this is going to be a problem, and once we get access to the test, is going to facilitate the process big time, and we know exactly which patient needs to be isolated and which patient can go home immediately. And hopefully in the next few weeks we'll have access to the test in-house in our facility, and we'll be able to make decision probably in less than an hour.
So there's a lack of testing kits, not only in Kentucky, but nationally. Is that correct?
The CDC will save, especially the state lab will save these kits for the patient who are qualified for testing. There is certain recommendation who's going to be qualified for testing. We're talking about people coming from endemic area. We're talking from China, Hong Kong, like some areas like across Europe. So these people immediately will be qualified for testing. If you're part of the outbreak, you definitely be qualified for testing. If you have symptoms and exposed to somebody confirmed with the COVID-19, you will be qualified for testing. However, there are some entities that are not part of these three like big lines. Like for example, 65-year-old gentleman or female having like respiratory symptoms, and you do all the tests, they come back negative, and the patient is sick. Who knows if the patient has the COVID-19 or not? So there is some uncertainty regarding these patients, and we need definitely more tests to be able to figure out, are we dealing with the right case or this is something different?
Has there been any talk about when more tests may be available to this area, to this region, or to the state?
We have the commercial test for sure now. So we have LabCorp, Quest, they're already making that test. The problem, the turnaround time is around 2 to 3 days, and this is not good for any institution. You cannot keep anybody in isolation for 2 to 3 days to get the test just for the sake of getting the test. And unfortunately, once you start the process of isolation, you have to keep that direction. You cannot stop that. So the turnaround time is the problem here. And once we have access to a kit or to a test that has smaller or shorter turnaround time, the problem will be much, much easier.
See, currently, you can still go through the Department of Public Health State Lab. However, testing is limited as he described, and that turnaround is much quicker, but then you have to meet certain guidelines, whereas if he wants to order a test and he can go through commercial labs, there's a little more,
Sure.
there's a little more discretion, at his discretion as a provider and a clinician, to do that, but then you have to wait a little longer for a commercial lab. They're just not getting a turnaround as quickly
And to
as
do
we
the state
want
lab, there is a certain format that you have to fill, and you have to call them in person, justify the case, and make sure this is a strong case to be able to be qualified for sending the test to Frankfurt.
And it all comes down because of the number of tests that are
Right.
available.
So if we do test an individual, if somebody comes to this area and we do test an individual and the case was made to the state lab and they've confirmed that this is the right person to test, the test comes back negative or the test comes back positive. At that point, that patient will be in isolation for 2 to 3 days until the test comes back. And if it does come back positive, what's protocol for treatment and what is treatment?
Let me explain. We have two different algorithm here. So we're talking about patients seen in the clinic and patient coming to the hospital. Okay, so there are two separate entities. So the CDC guideline, if somebody come into your clinic and these patients are qualified for testing or probably meeting some sort of criteria for COVID-19, you have to put them immediately in a room and you close the door, preferably negative pressure room, but if you have no negative pressure room, that's fine. You have to make sure that the door is closed. You have to make sure that the patient has a face mask immediately. And the person taking care of the patient, they have to be fully geared. They have to have the N95 respirator, they have to have the goggle, the gown, the gloves, and they have to take care of the patient seriously. At that point, if the patient is qualified for testing, we swab them, okay? And if they are having mild symptoms, we don't admit them. We ask them to go home, okay, quarantine themselves. We follow on them on a daily basis by phone calls, and based on the test and the situation, we make a decision. If the patient stays fine, they have no worsening of symptoms, there is no point for them to come to the hospital because we know they're doing self-quarantine. If the patient getting worse with more symptoms, then definitely we need to take care of them and we need to escalate the level of care and bring them to the hospital. This is number one. Number two, if the patient coming to our ED because they're sick, having lower respiratory symptoms, they cannot breathe, they have fevers, white count, multi-organ failure, this is absolutely different process. My team is so dedicated and so well-trained. We are an Ebola assessment center at PMC, and our team can take care of any communicable disease. So they start the process from immediately. So we have one entrance where my team can screen the patient immediately. They have to ask certain questions. And if they meet the criteria, immediately a face mask will be handed to these patients. And then they go through a negative pressure room and we start the process. So we start with triage, testing, treatment, and based on the test, we'll make a decision down the road. But I want to say one thing. Regardless of the results of the test, these patients will get the same care. So they're going to get the care of respiratory illness because COVID-19 has no specific treatment. There is no specific vaccination, and the treatment is mainly supportive. And that's what we do for every patient coming to our facility for any respiratory illness.
You know, you mentioned the face masks. There's people out there getting rubber gloves, they're getting face masks, they're getting, you know, buying toilet paper off the shelves and Lysol and all that stuff. Let's talk about that hysteria. Are face masks effective? Should people be going out and doing that? And what should we recommend at this point?
Well, absolutely. We want to reserve our, what we call PPE, personal protective equipment, for our frontline healthcare providers and first responders. It's vital. And actually, if you're well, the face mask usually by the general public would not be worn correctly to begin with. They would be misused. So there would be some fake confidence there, and people would be exposed inappropriately. So, and we really need to save the personal protective equipment for the healthcare providers so that they can do our jobs. I mean, God forbid that they run out of personal protective equipment and we can't keep them well. That's first and foremost important.
I want to send the message to the public. If you're using face mask or N95 or N99 just for protection, you're wasting that mask,
Right.
period. Okay, the CDC guideline clearly saying there is no recommendation to use any face mask or surgical mask or N95 to protect yourself from the infection. The only time that you need to put that mask on you if you're in close contact with somebody who's sick, that you know the patient is sick. Okay, this is the only time basically you'll be able to do that. Keeping that distance of 6 feet is very important. That's why we talk about precautions. But she hit a wonderful point, because if the public is going to manage the panic by another panic, it's going to be a problem for our healthcare system, because we're going to be out and short of all these equipment, and these equipment are essential to take care of our sickest patients.
The virus broke out somewhere in China, about somewhere around last week of December, first week of January. They now, in the province of Wuhan, I believe is how it's pronounced, they now are seeing that the patients are now stabilizing. There's not seeing any more spread of disease. It took about 6 to 8 weeks. Are we prepared in the United States or in Kentucky or Eastern Kentucky to let this thing last? What's the time frame for this thing to get out of control? And is this a seasonal thing? I mean, when it warms up, is this thing going to go away like the flu does?
I think the CDC is a wonderful resource for us, and they're giving us guidance like around the clock. They have their system updated almost every day, and it's a very useful resource for us to manage our patient, to take prevention, to control the spread of the infection. So I believe we are prepared at this point. So if we're talking about the state level, I think the government taking the right steps to do that. From PMC standpoint, absolutely we're taking the right step to do that. We're prepared. We have our team so ready to take care of any patient. The clinic are so ready to take care of the patient. So I believe we are so ready for that. Things may go different direction. We wish for the best, but I believe we are ready at this point. And again, the message to the public, this is not the time for fear, for rumors, for stigma. This is the time for science, for facts, and for solidarity. We are all in this together, and hopefully all together we can go through that problem.
Judge, speaking of face masks, you know, we're getting emails. If you're in business and you have an email account, you're getting lots of emails from people who are allegedly selling you masks, and they have the treatment for the coronavirus. They've got treatment for this, and click here to buy masks for real cheap. We're finding out that these are huge scams going on because people are taking, the cyber bullies are taking advantage of this, and people who may not know. Can you talk a little bit about what people should be looking for to protect themselves electronically so that they don't get taken by these scams?
Well, it's my understanding the CDC would not be, or no government agency, the county, the state, they're not going to be sending you emails individually asking you to do anything like buy a mask or, like Dr. Fadi said, there's no treatment for coronavirus. There's no cure. And I just saw today that the state, I think it was the state of Ohio, has taken action against a former televangelist who's selling a product saying that it cures coronavirus or something along
Jim
those.
Baker.
Jim Baker. Didn't want to mention the name, but the simple fact of the matter is there will be people taking advantage of vulnerable people economically because of this. Yesterday there was a fake text that went throughout the community saying that there had been a confirmed case of coronavirus in Pike County. That's not true. And if there is a confirmed case, then either the health department or the appropriate government agency will let people know that. But again, I'm going to go back to the conversation I've had repeatedly with the doctor. We started talking about this weekend.
Sure.
Stay calm. And if there is a case, let the health department and the epidemiologists do their job. We've got excellent physicians here like Dr. Fadi that can take care of individuals who are diagnosed if it does happen. And at the government level, if you are solicited by someone, you think it's a scam, call the state police, call the Attorney General's Consumer Protection Line, because these people need to be held accountable for taking advantage of people during this type of pandemic. And we all are concerned about the financial implications to the nation's economy, to our local economy. But it's only going to get worse if we allow people to scam, particularly elderly citizens who are scared.
And I guess the rule of thumb on that particular situation is don't click on any email, don't answer that you don't recognize the sender, don't answer any phone on your cell phone or at your home who you don't recognize. The CDC is not going to reach out and call you. The CDC is not going to pick up the phone. The IRS will not do that. So we want to make sure that people understand that as well. We're going to kind of wrap it up here now. If you guys, I'll give you a few seconds if you want to do some parting words and just one more plea to do that, and I'll give a final parting word. Tammy, we'll start with you.
Well, one of the things that we've all worked here together is a community message. I call it community unity, so that we all have a unified message to Pike County because we all are in it together, and it's the 4 C's. And this is the way that we will keep from spiking that curve that we talked about. We'll flatten it, and we will have better outcomes. That's evidence-based. You can go to CDC and study that, but those 4 C's represent staying calm, as we talked about. Call that 1-800 number. Don't overwork our healthcare providers unless you really need them. Clean your hands, clean high traffic areas, cover with the tissue we have here. Make sure you cover and discard, and then contain yourself if you're sick. Don't put others, do that civic duty and don't put others at harm.
Very good.
So great words.
Doc?
Again, we need the public to support our healthcare system. Without their support, we're going to fail. If they're going to keep abusing EDs and the offices for no reason, okay, it's going to basically harm our healthcare system. We need them to be part of the solution against the war, against the COVID-19. We want them to be involved. We want them to be engaged. We want them to be educated and empowered by information. So follow our recommendation and guidance, and I think we'll be fine, hopefully in a few months.
Very good.
Yeah.
Judge?
Jeff, just on behalf of the Pike County Fiscal Court, any decisions that we make with regard to office closure, any steps that we take, they're not going to be based on politics. They're going to be based on listening to healthcare professionals, the people at the health department, the Kentucky Department of Public Health. Dr. Fadi is a valuable resource for our community. We are in contact with the governor's office. I've had conversations today with one of the senior advisors, Rocky Atkins, and we're going to make sure the public is kept in the loop, that they know what's taking place. And I would just ask the public 2 things. One, don't believe everything you see on Facebook or on social media, because a lot of that information is not accurate. The CDC website and the Tammy may be able to tell us the state website. There are resources out there. A lot of the decisions that are being made to close schools, some of those decisions are being criticized to stop large-scale public gatherings. But the way we have to address this is we have to stop the spread before it does increase the number of fatalities in this nation. And fortunately, we don't have any here in Kentucky. There's no fatalities yet, and we want to keep it that way.
Very good. Thank you. Stay calm, clean, cover, contain. I mean, those are the things. If an employee of yours is sick, send them home. If you see some of your fellow employees, send them home. Make sure they get the proper care. Make sure they get the containment that they need. Make sure that they cover up what they've got. And just use common sense. We've got to take personal responsibility to avoid this war. If we're walking around and we're not washing our hands a dozen or more times a day, shame on us. If we're walking around and sneezing all over people, we don't need to be doing that. We need to just take personal responsibility and take care of ourselves, take care of one another. We're all we got. Thank you very much.